Welcome back to Face the Nation. We turn now to the White House Director of Legislative Affairs, Marc Short. He is the liaison between the administration and Capitol Hill. Marc, welcome to the broadcast.
John, thanks for having me.
I'm going to pick up with something that Senator Collins said about pre-existing conditions. She says they are not guaranteed in this legislation. The president, when we spoke to him in April, said this health care bill that passes will have a guarantee, but this one doesn't. So the president's okay with that?
This one does, John. In fact, the Obamacare legislation required coverage of pre-existing conditions. This legislation does not change that. So pre-existing conditions continue to be covered.
So the critics of the bill say that's not the case. While the Obamacare protections may exist, states can opt out. So they can apply for a waiver. And then when they get that waiver, the terms that they have to meet are really fuzzy. And people who are involved in healthcare know that because it's really hard and they're going to have to squeeze out a lot of money, they'll take the path of least resistance, which means people with pre-existing conditions will see less coverage and higher costs.
Okay. John, look, this system's not working. Everybody knows that having Washington, D.C. as a central hub for this has failed. It's failed the American people, and prices are going out the roof. In Arizona, prices have increased by 190% over 4 years. In Alaska by 203% over the last 4 years. To your question, we guarantee pre-existing conditions continue to be covered. You're right that there is also an ability for states to apply for a waiver, but in that it's conditional upon them showing how they will continue to make pre-existing conditions covered on an affordable basis. There's also federal dollars that are provided to help states to do that. But nobody can deny that costs right now are going through the roof.
But leaving aside there are plenty of problems with the bill, as people on both sides say. But on this question of pre-existing conditions, the analysis from the AMA, from the AARP, from the Medicaid directors, they look at it and they say, what's going to happen is the vagueness of this language, which says that a state can opt out if it offers an adequate and affordable alternative, that is a huge hole through which states will increase costs, lower coverage for the most. We're talking here about the most vulnerable, people with pre-existing conditions. So if I'm out there with a pre-existing condition, and this is, of course, what Senator Collins was talking about, there's no backstop here. There's no guarantee. Someday down the road, it's going to get worse, and people would like some kind of surety, and all they hear is vague words about affordable and adequate.
John, the current system is unsustainable. The Medicaid dollars are going to go bankrupt. They're continued to predict a 6% increase annually that this country cannot afford. So it's no surprise that the special interests are opposed to it. The same special interests in those trade associations you mentioned went to bed with the Obama administration to force Obamacare on all Americans. Because why? Because it forced all Americans to have insurance whether you want it or not, and an individual mandate, and all employers to force force coverage on all their employees. This is something that they like the current system, and they want the government to continue to give more dollars. Now they're asking for bailouts on the CSR payments. That's what they want. That's not what's working for the American people. We need to change the system.
But anybody with a pre-existing condition is not wrong to think that their costs might go up and their coverage might decrease.
They will continue to be guaranteed coverage, John. That's what we've said. The law does not change that.
But it might be quite different from the coverage they have now because of this opt-out that a state
likely
can
the
do.
Coverage they have now is not working. The system is not working. Coverage for millions of Americans is not working. That's why last year 7 million people chose to pay the penalty instead of get the terrible insurance that's offered on the Obamacare exchanges.
Well, those
they don't
people
want
with
it.
Pre-existing conditions.
Those are people that are saying
those are healthy people.
There's a mix of people who are saying they'd rather pay the penalty than have to pay the taxes.
Let me ask you about the president's push for this. He spent 90 minutes in Alabama this week. He talked about a wide variety of issues. Why does the president, who's a marketer, who has some skills in that regard, not go 90 minutes on the benefits and beauties and wonders of this plan? He talked about how hard he was working. He has a list of people he's jawboning. But why is he not out there selling this plan for all of its great merits? Is it because there are not merits that he can sell to his voters?
Oh, no, I think he actually is selling it, John. I think that he's had many calls with those senators who are on the fence. He's continued to make calls to the weekend, and you saw his activity in the first go-round. So he's continued to stay active. In reality, the whole Graham-Cassidy effort, it came to be because the first effort failed. And a lot of our voters are saying, look, this isn't good enough. Yeah. You promised us for years you would repeal this.
But here's a president who's got, I mean, on the phone, I'm sure he's got talent, but he's the rally guy. He's the 90 minutes whipping people up. He's talking about the NFL. Today, now the owners and teams and everybody's responding to the president who says something on the NFL. Isn't that totally getting in the way of your effort to fix this healthcare issue and get all the Republicans on board?
No, the president's a huge asset to our efforts on Capitol Hill. He's not getting in the way.
But the NFL issue is a useful one in terms of healthcare?
Look, I think the NFL one is an issue where the president has made a case that, as we've talked about, there are coaches across this country at high school level who are penalized and disciplined for leading their players in prayer. And yet you see an issue in the NFL where the media champions those who are taking a knee to disrespect the American flag. That is a dichotomy that most Americans can't understand, and for good reason. And the president's raising attention to that.
But he raised attention to not the prayer issue, but pointed out to players. I mean, you mentioned the prayer, but he didn't mention
Well, he's making the case that in many cases, there are generations of Americans who have fought and died to protect our freedoms, and fought and died for the red on that flag that represents the blood that's been sacrificed by so many Americans. And what the president is doing is saying, this is not the appropriate place to raise your social activism. And I think he's made the case that you have a First Amendment right, if you wish, to protest the flag, but owners have a First Amendment right as well. They have a First Amendment right to fire those players if they so choose.
All right, Marc Short, we're going to have to leave it there. We're out of time. Thanks so much for being with us.
John, thanks for having me.